Blood pressure refers to the pressure of blood pushing against artery walls, which transport blood from the heart to other parts of the body. In 2017, the American College of Cardiology and the American Heart Association published guidelines for managing hypertension, defining high hypertension as 130 to 80 mmHg, or above, and stage 2 hypertension as 140 and 90 mmHg, or above. High blood pressure, or hypertension, is a growing concern in many people, causing headaches, fatigue, and breathing difficulties. It also increases the risk of serious health issues like heart attack and stroke. However, there are ways to manage this condition. High blood pressure is a prevalent issue in developed countries, with nearly half of U.S. adults suffering from hypertension, according to the American Heart Association report. High blood pressure is a common health issue, especially in individuals who are overweight, consume excessive salt, lack sufficient fruits and vegetables, do not exercise, consume excessive alcohol or caffeine, smoke, have high stress levels, are over 65, have a high blood pressure relative, or live in a deprived area. High blood pressure is caused by a variety of health conditions, including kidney disease, diabetes, long-term kidney infections, sleep apnea, glomerulonephritis, narrowing arteries, hormone problems like underactive or overactive thyroid, lupus, and scleroderma. These conditions can cause blood pressure to rise in about 1 in 10 cases, and can also result from medication or underlying health conditions. Blood pressure can be increased by various medications, including contraceptives, steroids, NSAIDs, cough and cold remedies, herbal remedies, recreational drugs like cocaine and amphetamines, and selective serotonin noradrenaline reuptake inhibitor, SSNRI, antidepressants like venlafaxine. High blood pressure can persist without noticeable symptoms. Some people may experience headaches or bleeding noses. Common symptoms include headaches, nosebleeds, dizziness, shortness of breath, and chest pain. However, hypertension increases the risk of cardiovascular diseases and can lead to serious health problems over time. Daily consumption of certain herbal teas can effectively lower blood pressure, according to scientifically supported recommendations. The best teas for lowering high blood pressure are described in this video. Hibiscus tea is a fragrant herbal tea derived from the dried calyxes of the Hibiscus sabdurifer plant, native to Africa, and grown in tropical and subtropical regions like Thailand, China, and Mexico. Its fruity, refreshing flavor is enjoyed hot or iced and has various names worldwide. Many people drink it for health benefits, but research suggests some truth to these claims, but also potential risks. Hibiscus tea is a part of the mallow family of shrubs, trees, and flowers. Hibiscus tea is a popular natural remedy for high blood pressure, known for its health benefits and effectiveness in lowering both systolic and diastolic blood pressure. It contains natural ACE inhibitors that relax blood vessels, reducing blood pressure and making it a great natural remedy for mild and moderate hypertension. Recent studies suggest that hibiscus tea can lower LDL cholesterol levels when consumed as a tea or capsule, but not raise good cholesterol levels or lower triglycerides. However, the evidence is mixed, as many studies have been limited to specific conditions, and larger studies are needed to fully understand its potential benefits. Hibiscus tea, a plant in the mallow family, may offer health benefits, but also poses risks. It may cause allergies, medication interactions, pregnancy complications, and liver damage. Its phytoestrogens may decrease the effectiveness of certain medications, such as chloroquine, high blood pressure, diabetes, and birth control medication. Pregnant or breastfeeding women should avoid hibiscus tea or seek alternative options. It's important to use hibiscus products in small amounts to avoid negative reactions. The process of making hibiscus tea involves using ground or dried whole calyxes and selecting the right ingredients. It's a trial-and-error process to achieve desired strength and flavor. A longer steep can enhance the flavor, but oversteeping can increase bitterness. For dried flowers, use 2 tablespoons per 8-ounce cup, pour boiling water over the tea, steep for 5 to 7 minutes, and strain before consumption or storage. Ginger tea, a natural remedy in China and India, has numerous health benefits supported by scientific research. It's particularly beneficial for those experiencing coughs or sore throats. Ginger tea, a healthy root herb, has been found to help manage hypertension by improving circulation and relaxing blood vessels through its vasodilating properties. It acts as a natural calcium channel blocker and ACE inhibitor, similar to certain blood pressure drugs. Ginger's chemical compounds may help lower blood cholesterol and low-density lipoproteins, which contribute to heart disease. These components can form sticky plaque along arteries and blood vessels, creating blockages in the circulatory system that can lead to high blood pressure. Plaque restricts the inner diameter of blood vessels and arteries, reducing elasticity and causing further high blood pressure. To make ginger tea, slice fresh ginger, rinse it, and scrub off any dirt. Use 1-inch pieces per cup of tea. In a saucepan, combine ginger with fresh water, bring to a boil, reduce heat, and simmer for 5 minutes, or up to 10 minutes for extra strong tea. Pour the tea through a fine sieve to catch all the ginger. If desired, serve with lemon or orange for complementary acidity, or a light drizzle of honey or maple syrup to temper the fiery ginger flavor. Ginger tea can be transformed into various variations, such as ginger cinnamon tea, ginger turmeric tea, and ginger mint tea. Cinnamon adds warming spice, turmeric offers anti-inflammatory benefits, and mint adds cooling properties. Cardamom, the queen of spices, is a strong, sweet spice found in South India, Sri Lanka, Southeast Asia, and Central America, used to flavor sweet and savory dishes. Cinnamon, a globally recognized spice, is the dried bark of a plant grown in Sri Lanka, Indonesia, Vietnam, and China. It is used in desserts, savory dishes, and beverages for its warm, woody, and sweet flavor, primarily derived from the oil cinnamaldehyde. Cinnamon and cardamom are tasty seasonings with significant health benefits, although their effect on blood pressure has not been extensively researched, but some evidence suggests they may be helpful in treating it. Cardamom's antioxidant and diuretic properties aid hypertension patients in maintaining healthy blood pressure levels. A 2009 study found that consuming 3 grams of cardamom in 2 doses for 12 weeks can reduce blood pressure, improve heart health, and reduce the risk of heart diseases by controlling high blood pressure, a major risk factor. Hawthorn, a species of Crataegus, has been used to treat heart disease since the 1st century. By the early 1800s, American doctors began using it for circulatory disorders and respiratory illnesses, treating heart problems like irregular heartbeat, high blood pressure, chest pain, and heart failure. Studies indicate that hawthorn is rich in antioxidants such as oligomeric procyanidins, OPCS, and quercetin. Hawthorn is a natural remedy used to prevent heart disease, manage high blood pressure and cholesterol, and has been shown to enhance coronary artery blood flow and improve circulation. Hawthorn may be beneficial for treating high blood pressure, but more research is needed to determine its effectiveness. A study found that hawthorn extract was effective in treating hypertension in type 2 diabetes patients taking prescribed medicines. Consult a doctor before using hawthorn for high blood pressure. Hawthorn, a plant with a history of side effects, is safe when used in recommended dosages, ranging from 160 to 1,800 milligrams daily for 3 to 24 weeks. However, it may not show any improvement for 6 to 12 weeks. Heart disease is a serious condition, so it should only be used under doctor's supervision. Hawthorn should not be used by pregnant or breastfeeding women. If symptoms like pain, angina attacks, or exhaustion persist, stop taking hawthorn and seek emergency medical attention. If the condition doesn't improve after 6 weeks, consult a doctor. Side effects may include dizziness, vertigo, headaches, migraines, and palpitations. Hawthorn should not be used with prescription or non-prescription medicines, as it may enhance the activity of digoxin, beta blockers, and calcium channel blockers. It can also weaken the effects of phenylephrine, a medication used to constrict blood vessels. Hawthorn may also cause blood pressure drops when combined with medications for male sexual dysfunction or nitrates, which increase blood flow to the heart, increasing the risk of dizziness or lightheadedness. Consult your healthcare provider before using herbal supplements. Herbal teas can be beneficial for a healthy lifestyle, but they should not replace prescribed medications or medical advice for managing high blood pressure. Individual reactions to herbal teas may vary, so it's crucial to monitor blood pressure and consult a healthcare professional before making significant changes.